There is no Dr. Richardson this morning.
Okay, Marilyn, are you going to lead this off?
I will, thank you. So we're going to try and provide an overview of where we're at on a number of different issues, but I did want to start with some good news, which was that we continue to see a downward trend in our case rates. And we were happy that yesterday we only had an increase of 4 new cases from over the weekend. So that was encouraging. I say this as a preface to, I think on Friday, we were alerted to an article that was online in a online platform called 247wallstreet.com, in which the author of the article named Inyo County as the worst COVID hotspot in California with the highest case rate per 100,000 people. And the data, you know, is one of those odd articles where there was some accurate information that appeared to have been taken from our website, but there was a lot of inaccurate information, specifically the identified case rate that the author had indicated in his article. It's important to note that, you know, what the state shows as our case rate does have a 7-day lag. And so at the point that we were looking at last Tuesday, our case rate reported by the state was at 88.3 per 100,000, a decrease from the week before, when it was at 90. And in both those circumstances, in both those weeks, we were not the highest. There were other counties with case rates per 100,000 that were higher than Inyo counties. And in fact, our downward trend is continuing. We anticipate the state identifying our case rate for that they'll be posting today at probably somewhere less than 50 cases per 100,000. So I just wanted to clarify that for the public. And I wanted to, you know, thank those people who alerted us to the issue, you know, because it is, you know, trying to just ensure that our public has accurate information is really critical. The other issue that is coming, you know, there's always, with good news, there's sometimes not so, you know, everything balances. So the good news is the state is really trying to work on providing a public platform for disseminating information on vaccine distribution. And so they did stand up a data platform that with a dashboard to show what vaccination rates are occurring by county, which is a, you know, really an important platform to have available to our public. And it's also important that information is accurate. So, you know, the information that the state has right now is that Inyo County and Mono County, in fact, are both showing vaccination rates of less than 100 people, or less than 100 unique individuals have been vaccinated. This is woefully inaccurate. And, you know, just from our perspective, we have received and distributed in Inyo County well over 2,500 vaccine doses. And so it is very concerning, especially in light of the state messaging, giving us some messaging around those counties who aren't vaccinating and using their vaccine doses could be at risk of not getting more doses. Well, that is absolutely not acceptable, to have misinformation drive our vaccine supply. So we have elevated this issue to the California Department of Public Health, and we've also we had the opportunity about a week or so ago. Anna and Megan and Genoa and I met with 2 representatives from the regional coordinators for community affairs for Governor Newsom's office. They're out of the Inland Empire. So we did forward this to them also to request their assistance in either pulling the dashboard until it's accurate, or doing some messaging that helps provide more accountability and transparency to the public that the data system is flawed at this point. So just wanted to let you know that. Also, let's see. I think the other thing is that we have been working with Mono County to, not Mono County, excuse me, Northern Inyo Hospital, to reconcile our vaccine, the vaccine list. And we have now completely moved into that single port of entry, where people can register online. They can also, if they have any kind of questions about vaccines or any information they're looking for, they can email us at vaccineinfo@inyocounty.us. There's also a phone number that is available for the public for those individuals who maybe are challenged with technology and utilizing technology, or have access to a computer. They can call and leave their name and number, and we will have staff calling and returning those calls on Tuesday and Thursday mornings to make sure we can assist them in registering on the website form. We have a really good system in place to prioritize. We are trying to distribute the vaccines in an equitable manner based on the state's priorities. And so again, we have limited supply. We're working through the list, and we are, for example, in the age related, we are working through people in their 90s right now. So and then we will continue to do some prioritization around those kinds of issues. So I think the other key message that we want to convey is it is really important when we are scheduling, when you're getting your vaccine shot, that the schedule for your second dose, it's critical that we keep and maintain that appointment. We've been getting some requests from individuals to change their appointment because they want to go out of town or for whatever the reason is. But it's, there's a challenge in that because these doses come in vials. And so it's not like we can just schedule for a different clinic because that clinic is already, those vials are already taken. So it's really important that when making our appointments that we're looking at not only the first dose appointment, but your ability to maintain that second dose appointment. And I'm going to stop for a minute, and just Anna's going to also delve a little bit more into issues such as My Turn, which is the new data platform for making appointments that is statewide that we talked about last week. I think Chairman Griffiths brought it up in the meeting, and give you an update on that. And I think the only thing I would want to end with is the good news is that we have some downward trend, and it's important that we continue to take all of those precautionary steps that we advise on a regular basis. And I would add to that in response to some questions that have come up, it's not just important to, do those actions of hand washing and face covering and distancing. It's important that we're taking care of ourselves and that we are, that we're eating healthy, we're exercising, we're connecting with emotionally with our families and friends, we're connecting spiritually, that we are being holistic and taking care of ourselves, as well as engaging all those precautionary measures. So I'll stop, and Anna, have you add in.
Thank you. Just a couple of additional updates from basically in our work with the states. A couple of different things are happening over these next couple of weeks. One is that the state has rolled out a new platform called My Turn. We talked a little bit about it last week, and for us in Inyo County, our next steps in onboarding to that platform will occur this week. So we've had some overview of what the system does, and specifically it replaces a scheduling system that we had been using to schedule our public health clinics for COVID vaccine. This platform is going to be a little bit more user-friendly, a little more flexible, a little bit more responsive as we need to make adjustments during a clinic, for example. So we're looking forward to getting that onboarding done actually quite quickly. The two counties that piloted this system were LA County and San Diego County. Both brought the system on in a very short period of time, got their staff trained and started using it, and have reported that it's a very good system as far as tracking and making sure that people have good information about their vaccine appointments, that that the data is getting entered into our registry efficiently and directly. So we're at this point working on getting that aspect of the My Turn system rolled out in Inyo County. We will be ready to go live with that by this Saturday. There are other components that we've been told are going to be built into the system. One is a consolidated statewide registration platform, and at this point we haven't received all of the information that we need to be able to transition to that. So right now, as Marilyn said, we are still keeping our internal list of people who are interested in vaccine. We're consolidating that at the county level, as many other counties are. We do hope that at some point that will be able to be moved into the My Turn system, but don't have that process lined out yet, or information on how that will work. So we know that it's very important to make sure that the people that have already registered remain on our list, and that we work through it in the prioritized way that Marilyn lined out. So that will not be interrupted, but we may have some additional transition happening in weeks to come as this larger system gets built out and fully utilized throughout the state. Another component that may be built into the system is a volunteer management system. So we're monitoring that. We may be transitioning from the system that we're using currently, but in the meantime are continuing to enroll in individuals who are interested in volunteering for mass vaccination clinics, for example, once we have more vaccine available. So we'll be able to stand that up. So a couple of other things that may be changing over the next few weeks with that system, we'll keep an eye on it and make sure that you're updated as that rolls out. But in the meantime, we are onboarding for the basic part of that system this week to be able to manage our clinics and scheduling. Also announced last week, the state is moving. Currently, each local health department is receiving an allocation announcement once a week from the state as far as how much vaccine is available for the county. In Inyo, we've been receiving that at Inyo County Public Health and then distributing vaccine in lots of 100. So we've, over the past couple of weeks, have seemed to even out on receiving about 300 doses per week. Those are getting distributed to our partners as well as administered by public health, but 300 is not a lot to be able to spread around. So we've been working to make sure that Northern Inyo Hospital, Southern Inyo Hospital, Vaughn's Pharmacy have doses available, and we've been working with them to take our registration list and ensure appointments at those locations. Also, as vaccine is available, we've done focused clinics out of the public health office. So right now, this week, we're focusing on second dose clinics because we have second doses on hand and are awaiting some more first doses for us to continue to be able to administer out of public health. So with the vaccine available, that system has worked well, primarily because we have not a lot of providers. So that's allowed us to balance out and get that vaccine distributed amongst our providers. Over the next couple of weeks, we do anticipate that we'll be seeing a change at the state level. The state has executed a contract with a couple of third-party administrators, one being Kaiser Permanente and one being Blue Shield. Blue Shield will be responsible for overall vaccine allocation to providers directly. One hope that we have is that this will streamline the process, but it does take some of that local vetting and decision-making out of the local level and up to the state level. So with the trade-off of hopefully those doses will be sent directly down and there won't be a day or two of having to go through that process at the local level. So we are monitoring that. Has not got into effect yet, so I can't report on how that may or may not impact us. Our hope is, especially because we have a fairly limited number of providers, that it will go smoothly for Inyo County, but we'll continue to monitor that. Kaiser is working specifically on some very, very large mass vaccination clinics in a couple of locations in California, as well as while the state is also looking at other types of support that they can provide at the local level for mass vaccination clinics as we see more vaccines approved by the federal government and as more supplies become available. So we'll continue to keep an eye on what those resources are that may be available to us in Inyo County, in addition to building out our plans for eventually doing mass vaccination clinics in different communities. Final thing I wanted to report on is that we had in Inyo County, as with other counties throughout the state of California, we have received some funding for COVID response, specifically coming down as called epidemiology and laboratory expansion funding. So we've been granted already funding to be able to improve our contact tracing, case investigations, communication plans with the public. Just this week, we've received additional funding allocations that were just announced yesterday for counties to be able to build out more infrastructure for vaccine administration. We learned that Inyo County was allocated about $1.6 million for that. So we will be working on the adjustments to our current ELC COVID grants to be able to build out additional resources for our communities specifically for vaccine administration as well. So more to come on that as we get more details about the funding and how it can be used. And those are the updates that I had for your board today.
Thanks. I think before we go to Leslie, we will see if there are any comments from the board or questions from the board for Marilyn and Anna.
I just have one. Is there anything for our locals? I mean, should they be signing up for something if they've already used our system to sign up? That's the confusion I think that's going around. So maybe you could.
Are you talking about sign up for the vaccine?
Yeah.
If you have registered on the county's vaccine registration, that's all you need to do. So And if you need help for some reason, because you don't have access to technology or you're unfamiliar with accessing technology, we have a phone line that you can call. It has some basic information. You leave your name and number, and someone will call you and help you get registered. We have that's what the work we've been doing with our vaccine distribution partners to try and streamline and make this a more easy, fluid process. So, for example, Bonds will contact us and let us know they have X number of appointments next week, and we will forward them the list of X number of people that they can schedule those appointments. The same with Northern Inyo, and we have a meeting later today, I believe, with Southern Inyo to continue our work with ensuring that that's streamlined for them also.
I think that's a question that the main question that I've been getting is that, you know, they want to do whatever they can do to get scheduled for a vaccination. And so I think that'll really help.
Mm-hmm.
We'll know that if they sign up, I know you're excellent at getting back to them. I saw an article in the paper just recently, and that I think it's giving people a little more confidence in what they're doing and confidence in them getting the vaccination if they want that.
Yeah, and I would encourage people to, if you're registered, most people who are registered provide us an email, and weekly they are getting an update and from our office. And if they're not registered, if they're registered without an email, the best they can contact the phone line, which has some general updates. But you know, it will take us a while. I think when Anna was talking about the amount of supply we're receiving and the amount of distribution we need to do, we can assure the public that you will, if you are registered on our website, you will get an appointment. We just can't tell you an exact date at this point.
Thank you very much. I think that really helps.
Yeah, I agree. Supervisor Pucci, that's a good point with regards, I think you were talking about that platform, My Turn or whatever from San Diego County. And it is confusing because the counties worked very hard to consolidate the signing up process. And then we have this platform coming in. I would maybe look to Supervisor Griffiths since he's engaged so well at the state level. I have a lot of skepticism, quite honestly. I mean, if the state, I realize this is in regard to scheduling vaccines, but if the state can't get their metrics correct with regards to case rates, why would we want to, do we have to use that system? Is there a benefit to it? And it just adds confusion to the public. The other thing, and I'll defer to Supervisor Griffiths, but I had one other comment, and you mentioned, I have far more confidence in the county to do this correctly, I guess is my point. But you mentioned the additional funding for COVID response. And I think since we've got such a large population of people in that tier, I can't remember the tiers, but basically the 65 and older, the vulnerable, the population that is most vulnerable. You know, my 90-year-old parents, the phone apps and the websites and the emails, boy, you know, they're saying, can't we just hire some people that do a phone tree? You know, it's the old school system, but you know what, that human contact that you all are so good at, I would say, if we have the ability to skip this app, maybe people want to do it and that's fine, but I don't want to mess with the system that you've worked so hard to consolidate, that people now have some confidence in, and then just throw it. Well, I know you're integrating into that platform, but I'm just skeptical of that. And I would like to see funding that we're receiving spent on onboarding some good phone people who can speak with our elderly folks who are really concerned. Are they going to be able to get a ride to their appointment? How do they schedule? And then the email and the computer and the sign up form. Yeah, anyway, I've said enough, but I appreciate what you're doing, because I think you've worked hard to consolidate that single line, and I would just build and build and build on that unless there's some requirement that we have to get on board with this platform.
Yeah, I'll say, Supervisor Rozier, your comments are spot on, and it's the point that I've been making with the state, and it's not just me, it's everyone, urban counties, rural counties. Everyone is concerned about both the implications of the new app and how that integrates with what everybody's already done, and then the third-party administrator. How does adding a layer of bureaucracy on top of it all make any sense? And then the numbers, the metrics of the vaccines being distributed just being completely wrong everywhere, and to the point where CSAC has been in constant communication with the governor's office, but sent a really strongly worded communication that was signed on by RCRC and all of the different associations of the public health directors, and everybody was on board that this whole process has been made unnecessarily complicated, and they have not shown a great deal of confidence on this. And I wish I was more hopeful that we were making headway in this. The state, you know, they like to announce things without having it fully baked, and then feel obligated to continue with an idea that's probably not a great idea. So I am engaged and continue to be engaged at saying, and met with Dr. Ghali last Friday and said, hey, we have a system that is in place, and you know that we've worked really hard to give people confidence in that system, and changing it, you know, risks that and risks making it more difficult for people. So definitely hear you, and trying to do the best I can to communicate that.
Yeah, thank you for that. I know you are, and I appreciate it. I guess to ask our public health experts, what kind of latitude do we have with that? Do you know, or?
Yeah, with my turn specifically, and it is confusing because I have to say we've hired a couple of new staff recently, and the number of different systems we're using just to manage vaccine is kind of mind-boggling. But just for clarification, the component of the My Turn platform that we will be using initially is really just a tool for us within public health to be able to schedule our to schedule our clinics. And from a public perspective, there won't be a lot of change, other than people that are registering will get a little bit of, I think, clearer communication than what they have gotten with the platform we're using. So this is really more of an internal thing to help us manage our clinics as the first piece of the My Turn platform. I do think that there's the intent to continue to build My Turn out, but at this point we're not at a place where we're encouraging the public to register through that platform. That may be something once we have a lot more information and have figured out what the transition would look like and how we would be able to manage it, we may look at. But I absolutely hear your concern. I share it, that we want to continue to use and improve the system that we have in place for everybody who's registered already, and to continue to be able to reach out and communicate, especially with those who are isolated, don't have the access to technology, don't have the familiarity with using online systems, that we're not leaving those parts of our population behind. And I feel like that's something that we are very mindful of at the local level. Certainly not the first time that has been something that we've needed to incorporate into our planning. So we won't make any changes. I'm forecasting it now because I feel like some of these announcements do get made at the state level. So I want to forecast that there may be some other functionality that may be helpful to us, but it's not a requirement at this point, and we're not making any transitions at this point as far as our registration list or our wait list goes.
One other point, if I may, I'm sorry. This misrepresentation of our case rates infuriates me, to be honest. I find that absolutely appalling, especially when there's the possibility that that could affect the amount of vaccine we receive. And I don't know if that's 100% correct, but that's the sense I get. And I just want to know, and I'm new here, but I just want to know, what kind of latitude do we have? Everybody knows, if you went to statistics class, that there's good statistics, bad statistics, and statistics you can make to say whatever you want them to say. And I have not understood to this day why we extrapolate per 100,000. I understand there needs to be some sort of commonality in metrics, but when you live in a county of 10,000 square miles, this makes no sense to me to translate a case rate of 4 new cases to something like 88.3, because we have so much space in this county. Well, anybody can educate me, feel free, but I think that is absolutely appalling that our numbers have been misrepresented, and then we have to abide by these case rate numbers, and the people paying the price for that are small businesses and et cetera, et cetera, et cetera. I don't understand that.
I do want to make a clarification, and I'm sorry, Marilyn, if you have something more to add.
I was going to do the same thing.
So our case rate is not inaccurate. Our vaccination rate is. So the case rate that was reported last week that was over 80 was based on information from about a week prior. So that was when, just to clarify that 4 cases does not equate to a case rate of 80 per 1. So that's some information, that's some data that's older. Our case rates have gone down. So we're seeing a decline. And also to your point about translating that to a per 100,000 population, that has to do with what you just said, that we need to have a standard to kind of compare across the board, apples to apples. It doesn't make a lot of sense for us because we're so much farther below that 100,000 population. So we constantly have to do the calculations and go back and forth, so we really are clear about what we're talking about. But it doesn't, the basic data that's going into the case rate has been accurate that the state is using, and changing it to a rate per 100,000 does not, it still extrapolates to an accurate rate for Inyo County. The one other thing that the state has done, because our numbers are so small, is that as we move between tiers, there are some buffers, because our numbers, especially when they're put into a rate, can be very, have some very dramatic changes with just a couple of cases. And that's really where forever rates have not served very, very small populations well. So there are some buffers that the state has built in as far as moving between tiers to protect us from that volatility a little bit. So there is some recognition that leads to additional volatility in our overall data as it changes from day to day or week to week. The numbers that are not accurate right now on the state website are the vaccine, the number of vaccines that have been administered. So that we are talking to everybody we can possibly talk to. We have several associations involved. We're sending some of our data up to be able to reconcile that. We're not sure at this point why several very small counties have been, have not had their data reported. We've verified that the information that we've in our system that tracks vaccine is accurate, that it's going in, that there shouldn't be a disconnect in what data the state has available. But we're trying to get down to the bottom of why that dashboard got stood up without the accurate data for some of the very small counties.
Okay, well, thank you for straightening me out. I remember Supervisor Griffiths pointing out that sometimes your vaccine allocation is somewhat based on your ability to distribute. So yeah.
It's very important that we get it figured out very quickly.
Yeah, well, thank you for working on that so hard. Thank you.
Yeah, and it's Sorry, just real quick. It's just annoying that our staff has to spend time dealing with reporting and numbers and all of that when the focus should be on public health. But it is what it is. So go ahead, Matt.
Thank you. Well, one thing I wanted to thank Marilyn and Clint for the really quick turnaround on those talking points on the Wall Street Journal article. That was very helpful. It was almost like real time. I was able to at least send back some information. So I really did appreciate that. Do the people that when they make their appointment for their second appointment, do they have flexibility in the time and date somewhat on that? You said you're having a little trouble with them, or some people saying, oh, I can't come that day or something. But when they make it, do they have some flexibility? Do you know that?
Right now, there is not a lot of flexibility because with the type of vaccines that we are using, and right now it's primarily Moderna that we're receiving in Inyo County. The vials need to be taken out the day in advance to be able to thaw. So we have a certain amount. So we need to know how much vaccine we're going to be administering. And unlike other vaccines, where we have some time frame once that vial's been the first dose has been drawn off that vial, we usually have a little bit more flexibility as far as how long we can use that vial, which means more flexibility in scheduling the person who's supposed to receive that dose. In this case, we have to use that entire vial within 6 hours. So that really limits our flexibility at this point in time. Once there's a lot more vaccine flowing and there's more dates available, things I think will even out. But right now, because we are so focused on not wasting doses, we're really trying to be very, very clear up front as we're scheduling first dose. You need to come back exactly on the date that we have scheduled so that we can plan and not have wastage when we're opening those vials.
Great. I just wanted to clarify that. So if there is questions, I mean, that's the way it's going to have to be, and it's pretty important, you know.
Yeah, and some things come up that are beyond control that we're trying to manage, but it does make it more difficult.
Right. I had these maybe are kind of for Jeff and, you know, just all of us, I guess. Number one, is there any chance the governor, I mean, we've seen, you know, big shifts here going on. Is there any chance that the tier system will get changed sometime in the near future? Because that, you know, seems a little outdated at this point. I don't know. Maybe it's all still good, you know, those numbers. But anyways, I'm just asking that. And then, Jeff, do you or do all of us feel like rural counties are really getting a fair shake on this? I just looked at that. You know, that's the 8 smallest counties. I don't know if it's the 8 smallest counties, but it is the smallest counties that are all on that vaccine dashboard as giving less than 100 doses out. So it's probably not accurate for any of them. And are we getting? Do we need to do some more work on as small rural counties on getting some recognition, or is there anything else that we need to do? I'll finish just a couple more things. One, that funding, I really like Jen's idea and was wondering about the same thing, as if we could use some of that funding for to outreach, to get people lined up for the vaccine, for people who, you know, a more personal outreach if we need to. That seems like, I mean, again, I know I'm always talking about Tacoma, Shoshone, Darwin, Keeler, Olancha. Those places don't all have internet. Some of them don't even have cell phone coverage. So figuring out how they can be alerted and know that, that they're in the system. And then if you do sign up for My Turn, I'm guessing people may have already done that, some and done the other also, done our local one also. But will My Turn send info? Do you think it'll spit out info to Inyo County from people who have signed up there? I might have one more question, but I think that's most of them.
Well, I'm hoping Anna can answer that My Turn question in a little bit more detail. I do want to let you know that we're working with our aging program to help with some of the dissemination for our aging community. And we will, as you know, once we know the funding parameters, that will help us in our planning on how to effectively utilize that additional resources. And I think we probably have all made a note of the potential need, the need for more outreach to some of our senior population and others who may be more challenged in navigating the technology. So, and Anna, can you answer the My Turn?
Yes, I can. So right now, if local individuals go onto the My Turn site, they can answer a couple of questions to see if they're currently eligible to receive vaccine. But until we stand up clinics where we're allowing people to register directly through that site, they can't register for any, they're not registered. There's not an option to make people think that they're registered. There's nothing in there right now to register Inyo County residents. So we'll continue to use the Inyo County website for that purpose for right now. It does have the capability eventually for us to open up clinics for people to register in directly. So that may be something that we use much further down the line. It's not currently active, so it shouldn't be capturing any other registrations in addition to the one that the list that we're already using.
Yeah. Do you think there's any chance that the governor's going to change the tier system?
We've not been hearing that. There's not been any significant steps towards changing the blueprint for a safer economy, which is the 4-tier system. And we were away from it for so long that it's gotten, trying to get back and acclimated to what does being in the purple tier, for example, mean, and how do we get to the red tier, and what will that mean? It can be rather confusing. So,
It's fine. I I'm really more asking if there's if you'd heard rumblings about them changing the numerics or something in there but go ahead, Jeff.
Yeah, so there has been a lot of advocacy in the rural caucus about making the tiered system more appropriate for rural spread out areas. And right now, what we've been hearing is that the CDPH and the governor's office have been really focused on, they were focused on the stay-at-home order, and they're really focused on the vaccine, but there's a lot of pressure for them to be making adjustments. And the last conversation I had with Dr. Ghali, he said, stay tuned. So you can read into that what you want. I don't know, but especially the northern counties that border Oregon, and the Oregon counties are, in a completely different, economic system as far as what's allowed and what's not allowed. That there's just a lot of pressure to recognize that and adjust the tier system, and whether that means adjusting what happens within the tier system, or making a carve out for small rural counties, similar to the case rate metrics that was made earlier. But my crystal ball says something's going to happen relatively soonly, but there's certainly been no announcements or official discussions.
That's when it usually happens, when there's no announcements or official discussions. Seems like. Okay, well, thanks. I am going to contact RCRC. Those 8 counties are all in RCRC, and the fact that they're all shown as under 100, and I doubt that Colusa or Del Norte might be right, is the next one up, but it looks like there's actually at least 9 RCRC counties that are misrepresented in there, maybe more. So I will ask them to at least try to get something, you know, off to the whoever's keeping this dashboard and see if they can get that corrected. Also.
Which dashboard are you looking at?
It's the COVID-19 vaccine dashboard, and I just put vaccine rate in a Google search and found it. And yeah, I mean, that's as Jen said, I mean, that is really frustrating to have them display that and then say, oh, by the way, if you're not doing a good job getting your vaccine out, we're not going to give you as much. And I mean, yeah, that's really, really tough spot to be in here. So.
Well, I'm grateful, Supervisor Kingsley, that you have the representative power within RCRC and Supervisor Griffiths with CSAC as well, and your executive board standing, and as well as everyone. But I think at this point, you know, we've got a legislative representative, we've got our, you know, our Ferguson group.
Exactly right.
We have to push this because it makes absolutely no sense. And, you know, the ICU percentage capacity disappeared overnight. So maybe it's time for the tiered system concern to go away.
That's what I wonder.
Let's see. Maybe I see there's a couple hand raised, but I think maybe we'll have Leslie give her report if she's ready, and then we'll take comments and questions from the public. Does that work for you, Leslie?
Sure. Good morning, everyone. Just wanted to bring you up to date. Last week was a flurry of activity in the business side of the COVID response. Friday was the deadline for both the final reports from the Revive grant and the application deadline for the Community Resiliency Grant. And so we're now busily going through applications, making sure that they're complete, and getting them prepared for the selection committee to take a look at them and start allocating money. And so that's moving forward smoothly. And that's really all that I have to report at this time. So if you have any questions, I'm happy to answer. Okay, thank you.
Okay, thanks, Leslie. Let's see, I see David Blacker's hand is raised. If we could promote David.
Hello, everybody. Greetings from Death Valley.
Go ahead, sir.
It is a beautiful sunny day here, as you would expect. And I have to just echo what Matt Kingsley and Jennifer Rozier have said about our current system of vaccine allotments for rural counties. Anybody who looks at the numbers and anybody who can add, you know, more than 2 numbers together can tell that all rural counties are completely getting shafted on allotments of vaccine. The example I like to look at most closely is Alpine County. Alpine County has a population of 1,100 people. And the state of California has received 5.6 million doses of vaccine, and we haven't managed to send them 2,400 doses so they could be fully vaccinated. Ridiculous. It doesn't take a lot of data to do it. All you got to do is go on the internet and look at what the population of the counties of California are and start allotting some doses with numbers that are more representative of their populations. I believe we'll see the tier system disappear because it has not worked. I think we all agreed that that our healthcare workers needed to get first shot at the vaccine. I'm thankful that we were finally able to get through the ones in Inyo County. But now we need to start seeing bigger doses or bigger number of doses so that we can have a bigger impact. If we can't do mass vaccinations in the near future, then we're going to have serious issues with the variants that are coming from other places and that type of stuff. And of course, you know, I know that our folks at our health department are doing everything they can to get us every dose they can, short of going up to Mono County and stealing theirs. Which, if somebody needs a ride, you know, I would be willing to offer it. But you know, obviously, we're going to continue with the Lone Pine Chamber of Commerce. Is going to continue to lobby as much, whether it's Assemblyman Mathis or Senator Borges or RCRC or whoever, to do everything we can to start getting the low-hanging fruit taken care of. I mean, I don't know of any place in the nation, let alone California, that has fully vaccinated an entire county. Any place. Be kind of nice if California was the first one to start doing it. At least show somebody some hope that the light at the end of the tunnel here is not a train. So we'll keep our fingers crossed. We'll keep working hard. And I was thrilled to see the numbers, the active case number drop down to 40. That is fantastic. I know that we are just entering our real tourism season here in Death Valley, and to be able to get down to, you know, the orange level would be, or red level even, and then the orange level would be fantastic for our ability to recover from the economic impact we've had to go through, and of course have a positive impact on the TOT. So we're working hard. And I want to thank you guys for doing these updates every week. I've spent more time watching county supervisors meetings in the last month than I had in the last year before that. So thank you all, and keep up the good work. And if you need anything out here in Death Valley, please let me know.
Thanks, David. Did you get any rain down there last week?
Barely. We had one good day, and then the big storm that shut down 395, we didn't get hardly anything. So no wildflowers.
Okay.
Hey, David, the horses made it back to the Ferns Creek stables this weekend, so at least your stables are back in business.
Yeah, well, I saw signage go up around the place. So it's, national parks are wonderful places, but when they're shut down and you don't see happy visitors, it just takes the heart out of it. So, you know, let's all do what we can, and we'll go back to trying to be the economic engine that we've been. So thank you very much.
Okay, thank you, David. Is there any other public comment? I see Shaylan Cuff, if we could promote. Good morning, if you could unmute yourself.
Yeah, thank you. I'm new to all this. I'm Shellann's husband, Ken, and I just have two questions, and then I'll stop. My first question is, are the 4 new cases actual hospitalized symptomatic cases, or are they simply positive tests? Then my second question is, if we have 2,500 vaccines out and young children and their young parents are in very little risk of suffering from this disease, is there a possibility that we could consider opening the theater and restaurants by Valentine's Day? So I will back away and listen to your response.
Okay, thank you for your questions. We have answers to those questions.
Well, as far as the new cases, I don't have offhand the information as to what level of illness they're presenting with. These are, what we are reporting are 4 cases with positive laboratory results. And so that is what's being reported, and that was over the weekend. And so that is a good sign. And then the question regarding the opening of industry is really tied to the previous discussion regarding the tier system, which is a state issued framework that we are required to follow. And so absent that being changed at some point, we are we are sort of stuck with those industry guidelines. Anna, is there anything you wanted to add to that?
No, outside of if we continue to see case rates improve, that would be one way to get there, but we'd have to see a pretty significant decrease in cases to get there by Valentine's Day.
Maybe you could, though, address what the situation at Northern Inyo Hospital is as far as ICU beds, or I think sometimes we get an update on how much impact there is right now going there. That might partially answer this question also.
I did not get an update from Northern Inyo yesterday. I don't know. Typically, Dr. Richardson is the one who has his finger on that pulse, and he's right now in a second dose clinic doing second doses for our long-term care residents. But my understanding was that they have seen a decline in their ICU usage also. Anna, do you have anything to add?
Most recent information I have is from last week. We did have, I believe, 3 patients in the respiratory care unit. None of them were ICU level. So at least at the end of last week, the Northern Inyo Hospital was reporting that they had cases under control. They weren't in a surge situation.
Okay, great. Thanks.
Okay, thank you. We have a hand raised by Joshua Nicholson.
Good morning, Board. Can you hear me?
Go ahead, sir.
All right. Thank you again for hearing us out. Just last week, I just had one question for Dr. Richardson, and I understand he's not here this morning, but I just felt compelled to address the resources he had spoken of last week. And so my question last week was just where he was getting his numbers and his information, and correct me if I'm wrong, but he had mentioned Dr. Tom Frieden, which was a former CDC director, and then a Dr. Mark Lipsitch, both of which are, I believe, epidemiologists and much more educated than I in all things science. But just upon researching them, a couple things came up right away, and one that raised concern for me is in June of 2019, Dr. Tom Frieden pleaded guilty to sexual assault to a family friend, and this doesn't diminish his expertise in science. All it does is call to question his integrity and his values. And then Dr. Mark Lipsitch had stated, and forgive me, I didn't write the date in my notes, but he had recently stated in the last few months that teachers should not be treated as essential workers when it comes to passing out the vaccine. And again, I'm not saying this diminishes his expertise or his education. But both these things, I'm not sure, align with our Inyo County government and our residents and its values. And I would just bring that up to the board. And if local decisions are being based on these men, that we would just take a pause and just do some research into the values of these men. And that's all I have. Thank you for my opportunity.
Okay, thank you for your comment.
I had a follow-up perhaps question maybe Director Mann can address, or maybe it's more for Dr. Richardson, but I have had some feedback with regards to that topic. I tend to have a little more interest in hearing what Dr. Richardson says. I've seen our 54-year veteran of the NIH Institute of Epidemiology change his mind numerous times over the course of the last year. So I have more faith in Dr. Richardson. I have had some people suggest to me, though, that this is a big task with a big county. And is there any possibility, I don't know how public health, how the public health officer works, but what if we could put assist him with an advisory panel of retired physicians or a broader base of information. That's a lot of work to have to disseminate. And I would be much more inclined to be reliant on him and local expertise if that's a viable option or even possible. Anything?
Yeah, I don't know how to respond to that. I would defer to Dr. Richardson also, and
Okay.
and whether or not he would see that as beneficial. I will say that Dr. Richardson relies heavily on reading the research that's occurring nationally and globally. He monitors and tracks that, and I think he's very thoughtful in how he ensures the assessment of the material he is reviewing. And I think it's important for us all to remember that that COVID-19 is a new virus to us. When it started to emerge more nationally and globally early last year, it was a new virus. It was while there's a coronavirus that is found in dogs and fish and that type of thing, this was a new virus in its current form that's impacting our population, and that as it has gone on, they have learned more. And so we have, what we were sharing based on what we were hearing in the early part of 2020 with your board and the public shifted also over time as more information, more research, and more knowledge was gleaned about this disease. So I do want to just sort of put that out there also.
Yeah, I appreciate that. And I agree with you. There's been so much learned over the last year, and there's a ton of information everywhere around the world. And it's a lot for one person to have to disseminate. I think that was maybe perhaps my point. There's a lot of information, a lot's been learned in the last year. And yeah, I would just appreciate maybe a help for Dr. Richardson. But anyway, yeah, I appreciate that.
Okay, thank you. I think unless there are some last comments, we're done with this item. Are you okay? Okay, thank you to the Dream Team. Keep up the good work. And we will move on to item number 10 under departmental personnel action.